I think all of us in this room, in some ways, whether we've been in the health delivery system as a patient or a provider, an advocate, or an organizer, we've all had that moment where someone looked at us and said, where am I going to go? Where are the resources? And I bet you each and every one of us have pulled out a card or said from memory, well, let me tell you, we think you should call 211 or the HUSKY Infoline. So we're here tonight to thank them for always being there. Over the past 15 years, the United Way 211 HUSKY has connected over 1.6 million residents with multilingual, specially trained staff who have provided that assistance. That number, we were going to say, if nothing else works, call them. And they've helped them to sign up and access HUSKY services. Staff at the HUSKY Infoline not only assisted HUSKY applicants directly, but I think some of the things that we don't highlight is how they've contributed to really refining and improving the system. They identify and track common and repeated problems or issues families have encountered, whether it's enrolling or accessing services. And that's really critical because we all love to talk about quality improvement and that we should always keep improving. We're never there. But it is about thinking about what is that mechanism that informs the system in real time about real families, around real issues. And that requires early detection and, in fact, the opportunity not only to help one individual we referred, but to improve the system to help all those children and families that come behind. And that's what the HUSKY Infoline staff have done. And one clear example is how they've reported repeated calls from parents whose babies turning 1 and teens turning 18 suddenly lost their coverage. Even though they were eligible for coverage, suddenly a birthday changed things. When 211 found this, they partnered with Connecticut Voices for Children and Voices reviewed the data, enrollment trends, and were able to verify what all those staff people knew every day, and that indeed those children in those critical points were losing their coverage at a much higher rate than other children, largely because of confusion about the need to renew health coverage for children in these age groups. And this firsthand knowledge and analysis that Voices helped bring to the surface really has dramatically affected the system and mitigated the loss of coverage. I think that provides a powerful lesson as we think about what is the kind of enrollment system we want in Connecticut in the future. We are considered one of the good states, one of the model states, but any kind of enrollment process, whether it's Access Health CT or HUSKY, needs that real-time reality check. Are we doing what we promised? Can people count on us? And how do we improve the system? It takes this two-way information in real time to ensure those in need are actually covered.
Thanks to the Connecticut Voices for Children for the award. We couldn't have better partners. And in a couple of minutes, I'll name some of our other partners, but Connecticut Voices has been tremendous in terms of the work that Pat described that we've been doing through HUSKY Infoline and in many other areas over the years. And Representative Rojas is right. When I get those research reports and documents from Connecticut Voices, they're keepers. I hang on to them too. And I was saying to Ellen before the event tonight, I think that Voices has done a tremendous job with its research, and as a result, it has a reputation for being a great expert and serious research, and also an honest broker on these issues, so that people from all parts of the political spectrum rely on. Husky Infoline began in 1998. Over the ensuing 15 years, we really did serve 1.6 million people in the state. Some of them a few times over the years, but the count is 1.6 million. It's an amazing thing that all of us at United Way 211 are very proud of. And what we did was not only help in terms of getting people who were eligible the materials and the assistance they needed to enroll in Husky, but we also, even after they were enrolled, helped them to navigate the system. And we even advocated on their behalf to get access to specific types of health. And just as Pat said, in the process, along with Voices, we were able to pull together reports and share them with state leaders and DSS and elsewhere on the barriers that were being experienced by people trying to access health care. And I think we did some good with it. And I tip my hat to DSS because they received those reports generally in a very constructive way, in the way we intended. And I think good changes were made in the system and the way services were delivered as the result of the work that we did together with Voices and other partners in this room.